All right, good afternoon. I'd like to call this meeting of the Rutherford County Benefits and Insurance Committee meeting to order. Let's first get started with welcome. We've got our new member here, Miss Donna Andrews. This will be her first meeting with us, and she is retired from the HR at the hospital with over 20 years of service. So welcome, Miss Donna, and we've got Mr. Greg back with us too. So good to have y'all back with us. The first item on the agenda is going to be approval of the minutes of September the 27th, 2012. Do I have a motion? Motion for Ms. Boney. Do I have a second? Mr. Hester. Having a motion and a second, all in favor of approving the minutes, say aye. Aye. All those opposed? Motion passes. All right, the next item is going to be financials, and we'll get with Miss Melissa Stinson and have her go over those with us, please.
We'll go over the month of November financials. If you'll refer to Fund 264, we'll begin there. For the month of November, our per employee per month cost for our medical plan through Cigna was $811.15 with a year-to-date average of $868.83. Compared to same time of prior year, we were at $685.07. Which shows a 3.1% increase. When we add our on-site medical experience, our per employee per month is $39.51, with the total per employee per month being $850.66, with a year-to-date average of $901.44. Compare that to prior year of the month of November was $762.67, with a prior year-to-date of $873.16 for a 3.2% increase year over date.
Have any questions on that? Ms. Stinson, that we've added more hours since this time last year, correct?
More hours to our clinics. We have added more hours to our clinics, but that was within this fiscal year, yes. I guess that's the easiest way to answer that. So since July, we have added more hours within the fiscal year.
Anybody have any more questions? All right, then you'll also go over the
Fund 266, if we're ready to move on.
Yes, ma'am, please.
Okay. For the month of November, our year-to-date is $376,882.62 compared to prior year of $260,016.82 for an increase of 1.45% over prior year. We have had a couple of at least one large month that you can see in the month of August, which is contributing to the increase over prior year in our OJI program.
All right, does anybody have any questions or comments for Ms. Stinson or on these two reports? Okay, hearing none, then we'll keep moving and we'll call on Mr. Dan Good to come up and give us our OJI report. Please, sir.
Good afternoon. I'd like to take in the report and just kind of touch on October and November both, if I may. On the first page of your report there in the upper left-hand column, you'll notice the injuries for the month of October. They totaled 22 injuries requiring medical attention, and you can see the breakout there in that block there. On the next page, we'll bring you up to date for the month of November. The month of November of 2012, we had a total of 20 injuries, which brings us for the year-to-date to 195. Of that 195, 146 of them were OSHA recordables, 89 had restricted days, 21 lost claim days, and 56 others. The next day will give you the graph for the last 3 years. And while this year may look like it's up a little bit, let me just put that into perspective for you. For this time to date, in the year 2010, we had a total of 194 injuries. In 2011, at this time, we had 221. And this year, we're, again, at this point, at 194, so, or 95. So we're back to where we were in 2010. I would like to point out, though, while we're kind of at the same point we were 2 years ago, the employment for the county is up. So as far as that's concerned, we're looking good as far as the number of injuries versus the employment. On the next page, the Board of Education in the month of October had 13 of those 22, and that was for a total incurred dollars in the month of October for the Board of Ed of $16,343. And on the next page, the Board of Education in the month of November had 11 of those 20 injuries, and they were $17,550. That's the Board of Education for the last 2 months. In the county general, in the month of October, there was a total of 8 out of the 22 that we had for that month, and they had $11,000. And then in the month of October, the county general had 9, and that was $5,800 total incurred dollars. And over the last 2 months, the highway department had 1 injury, and it had incurred dollars of $600 for the month, or for that injury, rather. Do I have any questions?
All right. Thank you, Mr. Dan.
Thank you.
We appreciate that update. All right. The next item on the agenda is going to be wellness update, and we'll call on Miss Kelly Perrin to come and let us know what's been going on the last 2 months.
Good afternoon. I'd like to give you the wellness report since our last meeting. These are September, October, and November numbers. The Wellness on Wheels program, we've had 3 events servicing Central Office and Blackman Elementary with 120 people in attendance. You can see the outcomes listed below. We had 22% of the people tested with abnormal and elevated HDL ratios and 36% with elevated BMI. We have referred any of the patients with abnormal screenings to the MedPoint clinics for further evaluation and health coaching. There were 51 people that got DermaScan screened. The wellness program for Rutherford County government has been awarded the Fit Friendly Award through the American Heart Association for the 4th year in a row, so we're pleased that we're still progressing in that area. The Healthy Cooking class, the last one that we had last fall, had 12 people. Next is our wellness fair numbers for 2012. We had 306 employees register at the door. 17 people had mammography screenings. 25 people had angio screenings. We gave out 360 flu shots and collected 122 pairs of shoes for the shoe drive. We also played that medical screening bingo, which some of you are familiar with the card, but we had 11 free medical screenings available to the employees and their spouses, and we had 125 people participate in that. So at least 125 people had a minimum of 5 screenings, so they could have had more than that. But we had the Kroger gift cards and public gift cards to give away. We had 125 people participate in that drawing. For the individual health care coaching through the MedPoint clinics, we had 20 new cases during the quarter. 18 cases were follow-ups, and we closed 15 cases. And on the back of the sheet, you can see the Walk Across Tennessee numbers. We had 344 people participate or sign up for the walking program, and we had 248 people completed. It was an 8-week program, so we had 72% completion rate. And we had, of the people that did the wrap-up survey, 60% reported reduced stress, 78% reported increased energy, and 98% reported that they were going to continue exercising after the program. So we're excited about that. Tina Barak of the Health Department won the Kindle donated by Stonecrest, and Stewartsboro Elementary Cafe won our team prize. For upcoming activities, the Frosty Fun Run through Fleafy is December 8th. Wellness on Wheels will go to the Central Office Maintenance Department on December 14th. And we will start our HRA biometric drive the first quarter of next year, as well as a Manage Your Weight program that will be 6 weeks long starting January 29th. Anybody have any questions? Thank you, guys.
Okay, The next item is property and casualty and OJI bid. We'll get that update from Miss Stinson, please, ma'am.
Really I'm bringing to the committee to request approval to go to bid on the current lines of business that we have through CCMSI, and that will include our property, inland marine, crime, general liability, our auto physical damage, auto liability, public official, law enforcement, and school leaders, E&O insurance, as well as our accident insurance that we carry for reserve deputies and voluntary firefighters. In addition, we will be putting out to bid all the services that they provide for us in terms of our OJI program, which includes the TPA services, the management of our claims, and the legal services that they provide for us in terms of coordination, payment of bills, and things of that nature. So today my request is that I have approval from the committee to go ahead and put this out to bid at the beginning of the year, which will mean that if we go to bid, a short meeting like this will probably not happen for a long time again, so enjoy today. So.
All right. And then are you needing a motion to go with that, or is this just a FYI? Yes, so can we have a motion to approve this to be sent out for bids for the property and casualty and then the OJI? Ms. Boney made the motion. Do I have a second? All right. Mr. Jordan with the second. Any discussion or questions? All those in favor of the motion, please say aye. All those opposed? Motion passes. Thank you. Ms. Stinson, do you have any other business, or could you give us a heads up on where we're at with the Benesink hidden paycheck for the county general?
We actually met last week, Ms. Nolan, Ms. Stevenson, Ronnie Grimes in our office, and myself, to discuss the items needed for completion of the total compensation statement. So we are currently in the process of gathering that data. We have finalized the design of the actual benefit statement, and the expectation is that all the data will be provided in January, and no later than the end of March, being an outstanding date, would we have those out. So as soon as we get the data, they can get them processed, then we will put those in the hands of the directors and elected officials on the county government side for them to distribute and meet with the staff as they have committed to do.
Okay, thank you. Anybody else have? I have one more little question. Where are we at on the timeline or information on our Take Care retail startup? Supposed to be February 1st. Can you give us the update, please, ma'am?
Yes, we are on target to have that rollout effective. This is the expansion into the retail clinics. The 16 Walgreens Take Care clinics located in Middle Tennessee. We are in the process of finalizing all of the data pieces and the development side, and we will soon begin on the marketing pieces. And once we begin on the marketing and finalize those, then communication will go out to employees. And what this enables them to do is to go to a Walgreens Take Care clinic at retail and receive the same services that they would receive at one of our MedPoint clinics at no cost unless they are an HRA plan participant. And in that event, the $50 copay would apply in the same situations as it currently does at the MedPoint clinics. What this allows us to do is to expand services without incurring the brick and mortar cost of trying to build a new clinic, which, as I previously said, is about $250,000 for us to do that inside of a school. So I'm very excited about that, and I think the employees will be as well. We did talk to some employees during the open enrollment meetings to talk about what their spend was as they looked at the various plans that we were offering for 2013. Kind of tossed that out to a couple of different locations just to see what the feedback was, and there was a lot of excitement because convenience counts in the busy lives of everyone, so I think it will be well received by the employees.
Great, thank you. Does anybody else have any other business? Yes, ma'am, Ms. Stevenson.
Not related, but if tomorrow night you guys don't have something to do, we have the Main Street Christmas tree lighting event that will be here at the courthouse. Begins at 6. 2 of our county schools are going to be participating. We have the campus school will be participating, and I've forgotten the other school. I think it's Central Magnet, but I'm not positive. But 2 of the county schools are participating. One of the city schools, a local church, and the center, not the Center of the Arts, but a ballet. The ballet is going to be here. So if you don't have anything to do tomorrow evening at 6 o'clock, please come down.
Thank you.
I have one final thing. We will not have an insurance committee meeting in December just because of the difficulty of scheduling, so we will reconvene again in January for the next meeting.
Well, having no other business, and before we adjourn, I'd just like to take this time to wish everybody a Merry Christmas, Happy New Year, and safe holidays, and this meeting is adjourned. Thank you.